Good morning, Susan Frampton. As the President of Planetree International, we are very pleased to welcome you here to ACHS International today. Can you tell us a little bit about Planetree's origins and about the directions and priorities for Planetree at this point in time?
Okay, well, first of all, thank you so much, Karen, for inviting me. It's wonderful to be here with you. So when I think about Planetree and our origin story, per se, it's unique in that we were one of the first patient-centered organizations founded by a patient over 40 years ago. In San Francisco, actually. And we were started really because of this patient's experience with her hospital care. It was not an optimal experience. She felt very much that it was an impersonal, dehumanized environment. So while the clinical care was good, her care as a human being was not. So she founded Planetree to change healthcare, to ensure that healthcare providers looked at everything that they did through the lens of the patient, through the patient's eyes. And so she founded Planetree with that mission, and we've continued on that mission. So we very much advocate for patients' rights to be involved actively in their own healthcare, in understanding the implications of healthcare decisions, and that, I think, is really continue to be our mission going forward. We've looked at many ways of broadening that from our early work just in hospitals to work now across the whole healthcare continuum.
Okay, so you're working outside hospitals?
Yes, yes. Okay. Quite a bit of work is being done in long-term care, in primary care, and while we started in the U.S., we now work in about 29 different countries.
And so, Susan, how would you describe a truly patient-centered service?
Well, I think of a truly patient-centered or person-centered healthcare service as one where there's a commitment to partnering with patients and families to ask them what's most important to them in their care delivery experience, and then to invite them to co-design approaches to care delivery that meets their needs and their preferences. And that sounds like a fairly direct thing, but it's actually extremely challenging for providers to take that step back and say, I'm going to give up some of the control, so even though I'm the expert here, and I'm going to ask patients and families what their needs are.
Okay. And so when you look around the world, and you, as you said, you're working in many different places, what do you see as the high performers in patient-centered care?
Yeah, I would say while there were certain parts of the world that were early adopters in terms of patient-centered approaches to care. And I think of actually Australia, the U.S., Western, some of the Western democracies in Europe. Now it's a global phenomenon, and some of the most innovative work that I'm seeing is actually in the Middle East.
What do you see as the truly high-performing patient-centered organisations, and what are they doing differently?
So I think of a hospital that we recently visited with in Saudi Arabia, where it is a totally digitized virtual hospital experience. And there's almost no paper. Everything is either done on kiosks, everything's done real time, text is used extensively. People are more involved in self-management through apps. So there are some interesting innovations that are taking place in different parts of the world than perhaps traditionally were taking place around person and patient-centered care.
Yeah, so, and you're really seeing that increased interest in rising to those standards and ensuring that a holistic approach is taken to the way in which patients are cared for. And what do you say about the hospitals and health services who say, oh, this is all too hard and it's just something extra that we have to do?
That is a very common comment that we hear because I think healthcare is a somewhat stressed industry. People do feel like there's so much work we have to do, so many standards we have to meet. But my pushback is there is nothing more important than delivering care in a humanized way, in a compassionate way. That's what people patients, families, staff. That's what they want to be involved in. And so my response now is a little bit different than in the past. In the past, I would try to appeal to their altruism. Like, this is the right thing to do. It's very important. You would want to be cared for in this way. Now there's a bit more of an evidence base. And we actually did a very interesting project with the National Academy of Medicine. And we gathered the research and the evidence base behind the connections of patient engagement in their own care and better clinical outcomes. And so we've been able to use that evidence base to kind of prod people to say, this is better medicine. This is just as important as all of the other quality and safety work that you do.
And being able to present that evidence and to have those conversations, particularly with the doctors and the nurses and the allied health professionals, gives a lot more gravitas and weight to the things that you're saying.
It does. And then if you have that added step, as we see in some societies, of tying your performance on patient experience or patient satisfaction, tying it to financial indicators, which we've certainly seen in the U.S. and some other countries, that really motivates people if you know that your reimbursement from the government might be tied to how you're performing on your patient-centered efforts.
So when you're thinking about patient experience, how do you see services assessing that patient experience, not just satisfaction, but the experience of care and indeed patient outcomes?
Yeah, I think we're still early in that, but there's a lot of conversation around that. And I'll give you one example that I think is the direction perhaps that we're going to see movement in around patient-reported outcomes in particular. So recently, the U.S. government put out a proposed rule that said, if a cancer hospital wants to be reimbursed for these 7 preference-sensitive procedures, you have to report on this patient-reported outcome measure, which is 3 questions that every cancer surgeon has to ask the patient before they do anything, before they schedule a surgery. They have to say, do you understand what your options are? Do you understand that there are these reasons to not do this procedure as well as to do this procedure?
So making people aware of risks.
Exactly. And have you had an opportunity to weigh in on what your preferences are before your surgeon has basically concluded this is what we're going to do. So really trying to get to that important conversational piece where the patient is brought into this before a decision is made for them. So that I see as a very important direction to be moving in. And again, certainly in the U.S. and I think in other healthcare systems, tying that to payment is a very strong message that we're not going to reimburse for this unless you have these conversations with your patients.
And I think there's been an increasing discussion in a range of different countries about making sure that we're assessing the actual outcomes for patients. And a lot of that work started in things like hip and knee replacements and looking at after the procedure and determining, has this made a difference to your life? Has it met the expectations of where you thought you were going to be at physically? And so starting to look at those outcomes is certainly something that I think we see emerging in a range of different places.
Yeah, agreed.
Thank you. So thinking now about governance, you talked about co-design at the beginning, so really making sure that you are engaging patients and families right throughout the organisation. What are you seeing at the governance level? Because I think many people think about patient-centred care perhaps at the bedside or at the interaction between a clinician and a patient, but at the decision-making level for the organisation, are you seeing much movement in the involvement at that level for patients and families?
Yeah, I would say so. There are really 3 levels that we could engage patients. One, as you said, is kind of that point of care level, and there's a fair bit happening there. And then there's at the organizational level, the hospital, the long-term care center, and then there's sort of more globally at a policy level. And I am seeing a lot of work being done at the organizational level where patients are being invited in new roles. And just a couple of examples that I love at some of the hospitals that we've worked with, patients have been now involved with human resources interviewing clinical staff before they are hired. So you can imagine how that conversation changes, right? Also, I've seen, patients being involved not only on patient councils, which in some ways is like the low bar. Like everybody can have a patient council and they can get together and talk about delivery issues. But actually having patient advisors assigned to key leadership team members so that they've got this, it's almost like the patient mentoring the administrator on let's keep very focused on what's most important to the people you deliver care for.
And are you seeing that in the safety and quality area
Yes.
as well? That partnership?
Right.
And it's making a difference to the sort of things that are being prioritised within services?
Right, absolutely.
That's very interesting.
Yep. Patient safety partners, the idea of patients sitting on quality and safety committees at the organizational level. And then I think at a policy level, we're beginning to see, again, patients sort of rising up and being involved. Certainly, a couple of the policy organizations that Plaintree is involved with, the National Quality Forum, the National Academy of Medicine, they're all now beginning to invite patient representatives, family representatives onto all all of their initiative teams.
So at a policy level.
At a policy level. Yeah.
Fantastic.
Yeah.
So right throughout the continuum.
Right throughout. So it's really hopeful.
So speaking about continuum and thinking about continuum of care, many of the initiatives that we're aware of in patient-centred care often have focused in the hospital setting. But thinking about beyond the hospital, are you starting to see more of a focus on the continuum of care, right through to care in the home? How are you seeing that pan out for patient-centred care?
Well, I think what we're beginning to see, and this is in part supported by technology, we're beginning to see more and more services pushed back into the home, into the community, and out of the acute care setting or even the community care setting. So, there's a whole hospital at home movement and some interesting data that's been collected on certain conditions that folks that come into an emergency department and normally would have been admitted to hospital are admitted to home. And then there's a care team that actually
keeping people out of the hospital.
Keeping people out of the hospital. And what they're finding are the clinical outcomes are just as good as if they were in hospital, but some of the risk factors are lowered and the cost is actually lower. So I do believe we will see more and more of this move toward how do we keep people comfortable, safe,
healthy,
and out of clinical environment. So it'll be interesting to see how this happens. And then, of course, there's the whole retail disruption that we're seeing in different parts of the world where, pharmacies and community centers are beginning to deliver care that used to be delivered in the doctor's office and primary care office.
So there's disruptive innovations
Absolutely.
that are happening with new models
Absolutely.
and in many ways addressing the needs of the patient or consumer.
Yeah, access, convenience, lower cost. It's hard to beat that.
What do you think the impact of things like artificial intelligence and new digital technologies is going to be in patient-centred care? Or in fact, is it the patients that are driving those new technologies?
Yeah, it's an interesting question. And first of all, I think whether it's a good, bad, or indifferent thing, it's going to continue to develop. There's no question about it. The investment in healthcare, AI in particular, and machine learning, it's happening. And there are some wonderful potential benefits, and there are some things that might make some of us a little uncomfortable. And one example in terms of a patient-centered approach that I came to know about is a study that was done with elderly, chronically ill individuals in California, where they were repeat users of the emergency room, and there was the understanding that part of the reason they were coming to the emergency room was not because they had an emergent issue. They were lonely. They had no one in the home to interact with, and they had concerns.
More of a social issue.
It was, social, complicated by their not feeling comfortable managing chronic disease. So this company created an avatar on an iPad or mobile phone, and it was a little care partner, and it was a little dog, and each patient got assigned their own. They could name the dog, and throughout the day they would interact with their pet. And the pet was actually an individual in a different country managing a whole array of screens doing real-time interaction with these elders in the home, reminding them, take your medications, get up and move around. But they formed these very tight, loving relationships with these avatars. So
so they evaluated that? There was
yes. And they decreased the use of the emergency room. They obviously cost comes down when people are not using the emergency room. But here's sort of the tale to also be aware of. When they finished the study and they took the little avatars away, people got depressed.
Oh.
So I think we've got to be careful about how we use technology and realize it can be very powerful if it's used in a sensitive manner.
Yes.
Yeah.
Fantastic. And one of the things that I've always been impressed about by Planetree's work is the way in which you've helped organisations to support staff and to build the capability of staff. Are you seeing organisations focusing in that way now on their staff as the care deliverers, and how are they supporting them to maintain patient-centred care?
Yeah, I would say absolutely, and maybe even more now than ever, because we've got a healthcare shortage looming as all of our populations globally are aging, and they're going to age out of the healthcare workforce, and we don't have as many people coming behind them. So keeping good people is really important. And some of the trends that I've seen are that the organizations are focusing more on the health and the wellness of their staff and really trying to support them, celebrating with them, really creating community at work. Also some interesting initiatives to help manage the stress of being a caregiver. And one initiative that I think is really an important one, and it acknowledges some of the unique stressors in healthcare, is a Tap Out initiative. One of the hospitals we work with put this into place. And this is where when a caregiver, often it's a nurse, could be a physician, is having a difficult time bonding with their patient and family. Because, we all know we're human beings, and sometimes the dynamic is not a good one. But we've always glossed over that and said, well, just be a good nurse and just get in there and work with them. But that may not be reality. It might not be best for either the patient, the family member, or that staff member. So this initiative, the caregiver can basically say, I can't work with this. I'm not the best person to work with this family. I need to be tapped out, and someone else come and take over this patient, and I'll swap you with another patient. So getting creative and being real about the stress in the workplace that employees face. We've got to do more of these sorts of things.
And are you seeing some of the strategies for enabling staff to walk in the shoes of patients and really experience what it's like to be a patient in care? Yeah,
and that's really been one of the things that Planetree has done since we started. Our founder, who was a patient, said, I want healthcare staff to sit in the bed like I did, to walk in my shoes, to know what it feels like. And so we continue to do a lot of experiential education. So we put healthcare workers in the shoes of patients. And one of the signature programs that we do, which I remember going through when I first started at Planetree, is a feeding exercise where you and I would be assigned to each other, and at lunch I would feed you and you would feed me. And then the debrief of that, because think about it.
It's a very confronting situation.
It's very intimate to feed someone. And you think about feeding, you think about toileting. In hospitals, we do these things to patients without even realizing how dehumanizing or upsetting it can be. So those types of sort of immersion experiences for staff, I think, are really important.
So you've painted a fantastic picture, and it's obviously an exciting time. And I'm wondering what you're seeing when you're thinking blue sky. What are you seeing as the future for patient-centred care? 2020 and beyond?
Yeah, I would say there are a couple of areas that I'm really excited about. One is to take some of the work that we do at the point of care with provider organizations and move it upstream. Wouldn't it be great if every nurse and every physician and every technician were educated with a person and patient-centered curriculum, so that they didn't have to wait until they got to a care setting where maybe they were sensitized to that, but that they were trained and educated, that they understood those concepts, that they knew how to support the kinds of practices that we're talking about, that they knew how to team and partner with patients and families. So we've got an initiative going right now with 5 universities that have health science curriculums, and we're working with them to adapt some of our person-centered certification criteria to
integrate that into
their curriculum. So that, I think, is an exciting opportunity. And then I think, as I mentioned before, we will see more and more technology enablement of patients self-managing, of patients having access in ways that are just a whole lot easier than they are today. And I think that is going to be just a global phenomenon for sure. So whether it's virtual care, we're seeing that, of course, all over the place, where we've got patients accessing specialists thousands of miles away via screens. I mean, that's going to become commonplace. So yes, exciting times.
It is, very much. And I'd like to thank you for sharing your thoughts today, Susan. And it sounds like an exciting year and into the future for patient-centred care. Really wonderful to have you here.
Thank you so much.
Thank you. Thanks.